Good. So welcome to all of you, and my special thanks to our speakers, of course, but I will go into that maybe a bit later, and but to our One Health Student Association, and of course to Thomas Field, who is our media manager and who is very active in trying to get the One Health vision outside its boundaries. And so thank you to our students, and thank you, a special thank you to Thomas. Also, a special thank you to our two guests. So our two guests are Marit Ostebo of the Department of Anthropology, and Terje Ostebo of the Department of Religion and the Center for African Studies. So Marit and Terje bumped into each other several times for no reason at all. But if I went to somebody's party, this was before the pandemic, they were always there. And so we started talking about the very interesting things that they are doing and what the One Health Center is trying to do, which is really to act as a funnel, right? To get all these different disciplines into that want to work with health, but that find it difficult to sort of help them and funnel them in this new environment of convergence. And I think that all of this bumping into each other had a reason, because this is a very important seminar. We are putting together things that generally struggle to synergize. And so I would like that the seminar, which I think is a true milestone, could bring some students right through its funnels, students who understand, thanks to this seminar, the very intricate interplay that there is around the different drivers of health, and that if you don't look at the big pictures, there's only so much that you can do with surgery, with medicine, and with other interventions. We are now able to look at the bigger picture, and I think that, of course, COVID-19 has really pushed us and accelerated our understanding of complexity. And so with this, I would like to welcome all participants. Thank you to our students, and of course start the seminar. And who is going first? Marit? Yes. And so I give you the floor, and I am very much looking forward to this exciting seminar. Thank you very much.
So thank you a lot for inviting us. We are also very excited to be here and to share some of the research that we have done related to COVID-19 in Ethiopia over the past year. So in this presentation, we draw on findings from a USAID-funded project that we conducted last summer with and as part of Oslo Analytica, a Norwegian-based policy institute. And we carried out this research in close collaboration with researchers at 10 universities in the Amhara, Oromia, and Tigray regions of Ethiopia. And as you can see in this slide, in the original project title, there was no explicit reference to religion. The donor was primarily interested in tracing the socioeconomic and political ramifications of COVID-19 in Ethiopia. So based on this, we developed a research proposal where we identified key actors and areas of research. And we also included a long list of detailed research questions. Just a few days before we were about to start the research, the project took an unexpected turn. because the donor asked us to scrap our preconceived questions and research ideas that they all had approved of, and to rather adopt an explorative approach to follow whatever was happening on the ground. And as a cultural anthropologist, I and also Terje welcome this turn, since this is an approach that we are very familiar with and often favor when we do research. So what we did during the very first phase of the project, rather than starting out with a list of research questions, we asked our researchers on the ground in Ethiopia to write 5 to 7 pages about what they had experienced, observed, and heard during the first phase of COVID-19. So this was in early June, I believe, or maybe late May. And it was this reflexive exercise that made us realize how prevalent religious interpretations of COVID-19 was in Ethiopia during the first phase of the pandemic. And this initial inquiry helped us to develop targeted research questions and identify 4 major research topics, of which religion was one. And then I hand things over to Terje for some slides.
So let me start with a quote here from one of our informants, saying that COVID-19 is definitely an expression of God's anger, his punishment for all wrongdoings and sin done by humans. God has throughout history sent pandemics and natural disasters like earthquakes, floods, locusts to show us his power and presence when our wrongdoings continue. So I'm not saying that this was something that every Ethiopian subscribed to, but it was definitely a recurrent theme among most, if not all, of our informants. And it was the dominating discourse on the ground we soon discovered in Ethiopia and different areas we studied. A couple of caveats here. It's important to note that these interpretations were recorded at a particular time during summer of 2020. Whether they have changed at the moment, whether they have been strengthened, weakened, we cannot say. But so it's important to realize that this is something that captured that area, and that interpretations such as these are not necessarily static. The other point that I want to underline here is that we don't think that this is any way particular for Ethiopia. It's not here to portray Ethiopia as an anomaly from other countries. For example, there was a study done in the US, or a survey, done in the US, that said that over 63% of religious Americans viewed the pandemic as an act of God or an expression of God's punishment. But we think that the lack of research that actually have dealt with this question in other contexts means that there are probably a number of similar ideas floating around both in our society and as well as in others. But like I said, this was the dominating thing, the dominating interpretation during our time of research. So if we go back in history during major pandemics and large epidemics, this idea of them being expression of God's punishment is not something new. It has been recurring throughout history, where there have been apocalyptic sentiments and notions about Judgment Day coming. And the main reasons for such interpretations are that these occurrences were extremely visceral, brutal, violent, with high mortality rates and rapid transmissions. So for example, during the Black Death in the medieval period, the estimate is that 2/3 of Europe's population died during that time. Similarly, in more recent time, during the Spanish flu in 1918, an estimated 20 million people died just in a matter of 17 weeks. And adding to this is that pandemics and such epidemics that were seen to be God's punishment were diseases that were new or that one didn't have any immediate cure. So all this added to the idea that this was God's or divine intervention. So in that regard, to look at to see that these interpretations continue today in Ethiopia is really no surprise. And this has been true for Ethiopia, but a couple of things to mention here. Initially, the idea in Ethiopia was that the virus wouldn't reach Ethiopia. Ethiopia would be spared. And that is a reference to a notion of an Ethiopian exceptionalism, particularly among Orthodox Christians, but also among Muslims. So here it says, Ethiopia እግዚአብሔር አገር ናት, meaning Ethiopia is God's country. And the church you see there is allegedly housing the Ark of the Covenant, you know, the box that that you can find in the movies of Indiana Jones, where, you know, the 10 Commandments is written upon. And the idea is that the Ark of the Covenant that was lost when the temple in Jerusalem was destroyed actually exists in Ethiopia. So because of that, Ethiopia is then seen to be exceptional, to be special, and would not be subject to the coronavirus. So before it arrived, people largely saw it as a punishment upon the Western world, very much related to the idea of homosexuality and acceptance of same-sex relations. So in that way, it was seen much as the white man's disease. That had to change, though, when COVID eventually arrived in Ethiopia. So the first case was registered in March 13, and that meant that interpretations had to be adjusted. So similar to the past, people start to talk about generic list of sin, like lies, gossip, drinking too much alcohol, killing each other, disrespecting each other, women being immodestly dressed, and, you know, the old one, having sex outside of marriage. So there was no doubt then still that this was an expression of divine intervention. It is not our intention here to downplay the severity of the pandemic globally in any way. We know that what we are today, we're still struggling, and there are millions of people infected and died. But the key point that I think is important to underline, and we'll return to that later on, is that the current pandemic has not been as violent or as brutal as in the past. We haven't seen bodies rotting in the street. There hasn't been situations where there not been enough people to bury the dead, as was the case in the present. So this graph here shows the development of COVID-19 in Ethiopia during summer or spring-summer in 2020. So like I said, the first case came in March 13. In early June, there were only registered around 1,000 cases. In September, when we ended the research, the registered cases was around 52,000, and registered number of dead were at 809. So given the fact that the Ethiopian population count for 110 million people, it means that these are obviously small numbers. But of course, we have to consider the relatively low testing capacity. So we try to triangle those numbers with our researchers, and they all confirmed that there wasn't much of visibility when it came to COVID-19. There were not increase in funerals. There were not, hospitals were not overrun with cases. But regardless of that, people were really frightened. When there was any suspected cases of transmission, these were immediately marginalized, ostracized, and there was this genuine notion of fear that this would be arriving and have significant disastrous effect. So the fact that there is a continuity with the past, right? You know, when these interpretations have been floating around during past pandemics, and they still are there when the pandemic was not as visible as before, made us ask, so how is this understood? Why do people still interpret this as God's interpretation, even if they don't see it, even if there's no immediate mortality, people dying in the street? And then this was a question that we've been trying to wrestle with. And our argument here is that we need to then to look a bit closer to the particularities of the current COVID-19 pandemic.
And so we believe, or we have found, the concept of the digidemic useful for understanding the COVID-19 pandemic. In a webinar organized by the University of Oslo in September 2020, the famous sociologist Anthony Giddens argued that we are living through the world's first digidemic, a reflection of the age in which we now live, the digital age. He never defined it, however. This was, you know, the only kind of closest that he came to a definition in his talk. So our definition of the digidemic is as follows: a messy, contagious, and affective socio-technical and biological process and constellation of bodies, viruses, things, numbers, and ideas. And the digi part of the concept points to the important role that numbers, mathematical models, and digital media play and continue to play in the current pandemic. And by highlighting the digital nature of the pandemic, we do not mean to downplay its biological nature, but we think that the concept of the digidemic reminds us that the current pandemic is both a biological and technologically driven global phenomenon. The digidemic is also a concept that allows us to recognize how not only diseases and viruses, but also things, ideas, and affect or emotions such as fear spread rapidly in a digital age, transcending boundaries and infecting people at a global level. And in what follows, I will present 4 closely interlinked key features of the digidemic: simultaneity, pandemic prophetic models, dashboards, and the media. A particularly important aspect of the digidemic is that of simultaneity. By this we mean that the digidemic transcends spatial and temporal boundaries and erases distance. The constant and unrestricted flows of information and images via social media, for example, make that which is distant near and real. So the digidemic turns that which is not yet here into potential and real threats. So the second feature we would like to highlight is the role of predictive disease modeling. And I think we all have seen the kind of models we see on this slide, and that we all have become very familiar with the call to flatten the curve. In Ethiopia, as well as elsewhere, the potential spread of the virus and its impacts drew heavily on mathematical modeling, visualized as we see in the two images in this slide, through graphs, maps, and tables. And these models are powerful tools of governance, informing us what the future may look like if we fail to wash our hands or comply with physical distancing rules. And while it's widely acknowledged among those who make the models, or the modelers themselves, that all models are wrong, but some may be useful, models have emerged as a hegemonic form of knowledge. They have become, or are often treated as if they are prophetic predictions. And in the case of COVID-19, many of the models that circulated conveyed visions of a catastrophic and apocalyptic future. A third feature, which is also very much or closely related to modeling, that is very characteristic of the COVID-19 pandemic, are the use of dashboards. And what we here are talking about is the real-time digital display of transmissions of deaths, visualized in colorful graphs and tables. These dashboards, which are easily accessible on the internet and spread rapidly via conventional and social media, and enable everyone to follow the trajectory of the virus in every corner of the world. So the Ethiopian government made its own dashboard, and people we interviewed described how they very eagerly were waiting for their daily release. These dashboards, posted by Ethiopia's Minister of Health, Lia Terje, were typically posted on Twitter and Facebook during lunchtime. It is here important to highlight that these dashboards conveyed numbers of transmission and death that remained disembodied and abstract. Nevertheless, visual tools like colorful maps, graphs, etc., had the effect of making the invisible visible, the abstract concrete. And then finally, a fourth feature of the digidemic is the role of both conventional and digital media. And I think we can think of this as a major vector, not only when it comes to the spread of COVID-19 related information, models, dashboards, and emotion, but also of the pandemic itself. The COVID-19 virus, for example, first reached Ethiopia via the media. Pictures of overfilled hospitals in countries like Italy were transmitted via TV and social media, visualizing a disaster emerging thousands of miles away. And this happened long before the virus actually was detected in Ethiopia. Distance was, in other words, manipulated by the digidemic's ability to create proximity and simultaneity, bringing the spread of the virus and its destructive capacity within virtual reach. So a political event that took place in Ethiopia during the time we conducted our research, in the middle of our research, serves to further substantiate this argument. In early July, a very famous singer and political activist, Hachalu Hundessa, was brutally assassinated. And this generated major unrest in Ethiopia and resulted in a 3-week-long government-imposed complete internet blackout. So for 3 weeks, there was no flow of information. And as one of our informants described later, since there was no flow of information, people completely ignored COVID-19. People behaved and lived their lives as if COVID did not exist.
So we believe then that all this together, the prophetic models that talks about or predicts doomsday and destruction, the dashboard that displays constantly climbing numbers of infections and dead, the digital media that are 24/7 spreads news that are in real time, visual and emotionally. All this meant that the technologies of the pandemic or the digidemic had this effect of making what was invisible visible. What was distant was became near, and that the potential threat of something became something like not yet here. It had the potential to arrive. Inevitably, it would arrive according to the prophetic modeling. And adding to this, the fact that nobody had any cure for the virus. All this demonstrated these very strong and real notions of fear. And for Ethiopians and for anybody elsewhere, the logical thing then was to view this as God's punishment for human sin. And which also meant, but this is again a complete different talk, that only God could be the one that could cure. So we'll leave it with that, and we're happy to take some questions if there are any.
Thank you. Thank you very much to Marit Ostebo and Terje Ostebo. And thank you very much to all the students who are connected. I see lots of names that I don't know, and some names I do know. And so it means that we have a mixed crowd. And so if you agree, I would invite our One Health students and the One Health Student Association, if any one of you has any questions, or somebody else. And actually, I would happy if Chelsea and the rest of the students could. We have Corina and we have me, could moderate this part, because this is your way, right, of putting yourself into, let's say, the interdisciplinary space. So I am more than happy to leave the floor to you. Please, Chelsea, thank you very much.
I see someone is using the hand raise feature on Zoom. If you want to ask your question. Yeah.
Thank you so much. Many thanks, Marit and Terje, for the fascinating talk. Really fascinating, because I've been working on reactions from India, Hindu reactions to the pandemic. And I've been struck by the fact that it's quite different in the social digital media. And I just found your use of the phrase digidemic as an analytic tool just very, very interesting. Thank you. That's a really very useful hermeneutic here. Can you tell me what are the social media that's popular in Ethiopia, which is very common? In India, it's WhatsApp. And secondly, is the reaction, the religious reaction to the pandemic, by and large, interpreted as God's wrath, God's curse, in very biblical terms, as I can see it here. Because it's, like I said, it's very different, completely different, the reactions that I was monitoring over a period of about 8-9 months in India, that's why. And I could amplify on the difference later.
You want to take the first part, Marit?
Yeah, I can take the first part. So the most popular social media, I mean, Facebook is used. I think Telegram is a very popular media. And one thing that we didn't talk about here is that the Ethiopian health system, for example, to larger and larger extent, they rely on social media for ordering ordering medicines or for communication purposes, for communicating plans. And Telegram has emerged. So Telegram has emerged as this very important bureaucratic app used by the Ethiopian government, and also by a lot of others. So those are probably the most used apps among Ethiopians. Yeah, I don't know if you would like to add something, Terje, or whether we should say something about. There's a lot of censorship in Ethiopia when it comes to social media. So some other alternative platforms have also emerged based on that, such as, for example, Signal, that allows for encryption in a way that other platforms do not.
Yeah, well, better to say surveillance. I mean, government is surveilling social media. But you're right, the religious interpretation was dovetailed very much with, as far as I know, has been typical Christian and Muslim interpretation going back to the Middle Ages. So, like we said, God was angry because of sin. And one thing that we're not go too much in detail, but the dominant or the most referred to sin was homosexuality. Even if it of course exists in Ethiopia, it's highly tabooed, so it's something that is not really visible again, but still it was the main sin that people referred to of why God was sending this disease, so people should wake up and repent and change their ways. So it's very, very classical from typical from the past.
Thank you very much. And the main reasons the differences I see in reacting to the pandemic in the social media from India, the primary reactions have been increase in astrology and predictions, traditional ways of doing it, humor, cartoons referencing God's stories from Hindu narratives. Funny stuff, but it's almost like they're saying, this is missing in our lives, humor, and through this, we are restoring it. There's a restoration of balance. Third, performing arts, use of classical performing arts to teach people lessons on this social distancing, washing of hands. So really beautiful dances pressed to that. And fourth, prayers to specific gods and goddesses, God of healing, say this prayer 108 times, and so on. So those were the 4 buckets. I put all the memes and the cartoons and the short video clips into as reactions. And it is striking that not one goes back to the kind of stuff that you're talking about, which is much wailing and gnashing of teeth here. None of that. But thanks so much.
Oh, yes, another question. Dr. Kapoor. Oh, I think you're muted.
Yeah, I have a question which is really about, okay, so let's say that the world is currently worried that even if the developed world will be vaccinated for COVID, the fact that there will be pockets of viral circulation with no vaccine is very concerning, right? Because this is how they think that variants emerge. You have active viral circulation in absence of any antibodies, And that's how you get the variants. So the West is concerned about itself, and but also has to be concerned about the south of the world and the poorer part of the world. And so, of course, the solution to this type of problem is either making the infection widespread, which is, and you acquire herd immunity, but rather is to vaccinate. Even if you don't have a disease, right? So the virus will continue to circulate in countries regardless of the number of people it kills, right? So the virus is circulating, right? It's just that you don't see it because there's a different demography and because there's a different surveillance system. But the virus is going to continue to circulate. So my question for you is, the world, the leaders of the world, the Pope is saying we need vaccines for everyone, because this is how we're going to keep ourselves even protected from the Ethiopian variant, okay? But how can you convince a country to vaccinate for something that is the wrath of God? You can't. So there's I see a major bottleneck in the implementation of something which is extremely important for many, many reasons. Because if it's the wrath of God, and it's not about you, right? It's about the white man, and it's about all the ugly behaviors. Why should you get a vaccine?
So I don't know if you want to elaborate. So we have a second article that kind of deals with this second question. And I think what's important to recognize is that even if it may seem strange, different interpretations and different worldviews can exist at the same time. So it is possible to both believe that this is God punishment, but at the same time to also be accept public health advice. The one thing doesn't exclude the other. I don't know if that I know that it kind of makes, it's hard to kind of make sense of, but I think that's very important to have in mind, that, you know, and for medical anthropologists, this is kind of very obvious that, you know, people are shopping around and, you know, we're not dealing with, even we as kind of educated, westernized people, we also do not completely stay within one paradigm or one worldview. We are also kind of shopping for alternative explanations, or, you know, when, yeah, so that's my response to that question. And I don't really think, I'm not really sure that to what extent vaccines would be rejected in Ethiopia, and you may add something here, Terje, because there is some strong beliefs in vaccines and in everything that looks like a syringe in Ethiopia also.
Yeah, that's true. And I think in our country, we have had enough wacko theories about Bill Gates planting in whatever microchips through the vaccines or whatever. I mean, a lot of conspiracy theories which reflect a kind of, you know, ideas that are not necessarily strictly scientific. So like Marit says, it's important to keep in mind that even we can describe two different ideas, whether we can use crystals at one time and then go to the doctor at another time. And one example here is that in the beginning of the pandemic, tea with ginger was seen as the major remedy. And that is a common thing. So when people get a cold or something, tea with ginger is you know, the thing that people use. So what happened then during a 24-hour period, the price of ginger just skyrocketed, and in a matter of a couple of days, it wasn't even available. So that reflects that, drinking ginger reflects a kind of indigenous medicine or notion of indigenous medicine. It doesn't reflect that this has something to do with God or not. Now, conspiracy theories about Bill Gates and others were certainly floating around in Ethiopia too. So I think that that is something that's going to be a challenge. But again, it's not something particular to Ethiopia in any way. What to do with this? Well, I think a key thing would be that if the religious authorities needs to play an important role in coming to the forefront and talking about the value of vaccines. I think that's going to be extremely important, and I think they will. I think they will.
I have a question to build off of that. You were saying that they do censor like social media and stuff like that. Do you know if the government is like in favor of promoting vaccination? So would they censor things that are these conspiracy theories that would deter people from wanting to get them? Like, are those the type of things that they would censor? And do you think that would help promote getting vaccinated?
Well, it's hard to censor such conspiracy theories, and social media works in mysterious ways. But it's definitely clear that the government will certainly promote vaccination. I think it so far has received I don't know, 2 million doses of different kinds, which is, with 110 billion is not much. So hopefully it will be more of that coming. So, but again, I mean, ideas like this are floating around regardless of what authorities are saying, and we see that in our country as well.
For sure.
I have a question. So even in America, like you said, there is a resistance to vaccines that doesn't necessarily have to do with religion. And there's a good amount of our population that are deemed anti-vaxxers. Would you say that the amount of people in Ethiopia, would you say it's the same amount of anti-vaxxers there compared to the anti-vaxxers in the US, or is it more or less?
I don't think we have any data on that. And there may have been studies done on, perceptions of vaccines in Ethiopia. In general, I think that, a lot of Ethiopians, they expect, or they very often, when they go to a clinic, they expect to get some kind of a shot or some kind of medical intervention. So in general, I don't think that they would be skeptical of vaccines. But again, we haven't done any research on this. So it's hard to say.
I have a question. So because it is based on a religious belief, and to what extent would you guys say that there has to be a point of intervention where you kind of tell people the vaccine is necessarily, like, despite their religious belief? Would that be an ethical issue? And how far would, the people of Ethiopia would be willing to take it?
No, I think there, again, like we would say, that one does not exclude the other. So even if they see this as God's punishment, it doesn't mean that they would be negative towards a vaccine. I mean, I've experienced personally when a person is sick, he or she might first, usually that's the first choice, go to the clinic and seek help. If that doesn't work, he or she will try some traditional remedies, some particular food or something like that. If that doesn't work, he might go to some sort of healer, either a Christian or a Muslim. And then you see often that Christian will go to Christian first, and then it'll go to Muslim afterwards. Whatever help is what they choose to visit. And again, this is something that there are parallel paradigms of science and religion that exist side by side, and one does not exclude the other. So I think that's an important thing to keep in mind in this regard. We'll see. And of course, as we know, attitudes towards vaccination in various societies tend to change over time. And we've seen this in the US as well. So because of information, advocacy, and so on, but also because of the severity of the particular disease, people taking it seriously. It's never static in any way.
Does anyone else have any questions?
Well, if you want me to close, if there are no other questions, thank you so much for being here. This was oxygen for our minds and fresh air. So thank you to Marit Ostebo and Terje Ostebo for presenting their work. Thank you to Thomas Field, who is really tirelessly following the students and making sure that students from different disciplines get connected between each other and have opportunities to discuss issues by, let's say, different points of view. So thank you to our students, thank you to our student association, and thank you to all our guests and friends for the seminar. It was a real pleasure, and I'm really hopeful that we can have more of these opportunities, to share different perspectives, because ultimately I think that health has shown how central it is, right, in our lives. Because if there's no health, the other things just stop. And I think that the pandemic actually has just showed us how we had sort of forgotten this, and we thought, we had sort of left, we thought we could do things, and that we weren't really going to be susceptible to something that we couldn't fix, right, as a species. And instead, it's not like that. We have to understand that health, we should value it and respect it when we have it. Because you can't only think of health when you are sick. You have to think of health when you are healthy, and you have to value it, and you have to start understanding that it is really the result of many, many drivers, which include our biological nature. We are animals. If you put us in a box, we wouldn't go by ourselves, and we wouldn't go with plants, right? We would go with animals. And so we are animals, and this emergency, this pandemic has shown us that we are vulnerable like many other animals. But it has also shown us that we are actually the animals that have the key to the system, and we should do more to reposition health. Not only of our species, but of multiple other species that are on the planet. Because if things go wrong, then they go wrong for everyone. So thank you very much. And thank you again to our students. And I wish you a pleasant rest of the evening. And thank you so much for being here today.